Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Hello, my friends. Thank you for joining me again on another special episode with repeat host. We have Dr. Mark Lin back. He did a great recording last month on career strategy, and he did such a good job for bringing him back to talk about continuing education. So by the end of this episode, you're going to be able to strategize better on picking the right CE courses, which courses to take, when is the best time to take them, and how to get the most out of your courses. So Mark, welcome back to the pod.
Thank you. Thank you.
So tell us about yourself again.
Okay, so my name is Dr. Mark Lin. I graduated dental school back in 1993. Did a one-year residency with a hospital in 1994, general practice residency. Then I practiced as a general dentist for the next 13 years. Kind of as I'm going through the dentistry, I've always thought and wished for a specialty. For various personal reasons, it was delayed. And then finally I made a commitment and luckily got accepted at University of Toronto for grad prosthodontics. So that was another 3 years. And since that time, another 15 years gone by as a specialist, as a prosthodontist. So my clinical experience ranged from a general dentist to a part-time academic at University of Toronto, and then now as a pretty much full-time practicing prosthodontist. I do attend grad pros as an instructor, mostly for surgeries in the grad pros for prosthodontic residents. I'm also the owner and founder of the Institute for Dental Excellence, which is continuing education for licensed practice dentists.
Yeah, it's Tide. You did a fantastic job creating that. Now you started Tide to provide continuing education to our colleagues. I started the New Dentist Study Club. Just a disclaimer, this episode is not promoting our own education courses. It's all about you. We don't want you to make the same mistakes we did in choosing continuing education courses, wasting time and money, choosing the wrong courses. So, Mark, what is your advice for a new grad? What type of courses should they focus on?
So I think first and foremost, we have to appreciate that once somebody graduates from any dental school across the country or even international, has gone through the IDAP program, what have you, we need to know and understand that, essentially learning is going to be a career-long process. And even at my stage at 32 years in practice, I don't know that I can say that I've learned everything and I know everything, because I think technologies are changing and more research is out there in terms of materials and techniques and what have you. So I'm pretty confident even myself, probably at the tail end of my career, I'm still very aware that education is part of on my agenda. And then everybody's on a different curve or learning path. And especially for new grads who's less than 5 years out in clinical practice, they have to even be aware of that. The second point I think is very important is that if we know that we have areas to learn, the question is we all have to understand what our limits are and, kind of sit there and reflect and say, you know what, I think I like to do more endodontics, but I don't have a lot of experience or a lot of exposures clinically or what have you. And so you will gravitate towards that type of continuing education. Or you may say, you know what, I hear a lot about dental implants. I have minimal exposure in dental school. I think this is something that patients are going to request or ask, and I want to be able to at least treatment plan, do some on my own that's within my comfort zone, and of course know when to refer and work with the specialty team and what have you, and know where the clinical limits are. So I think each practitioner have to sit there and say, what types of procedures, number one, that I think I like doing, enjoy doing, and I want to excel in. And you can't be good at everything all at once. So you have to kind of, have a plan for your timing, for your budget, financial budget, and make an investment and say, you know what, for the next 1 year, 2 years, I want to learn more and excel in certain fields, certain things that are not my cup of tea, I'm not going to get involved with and just make the referrals. So for myself, I'm not trying to um, be an excellent dentist for pediatrics, for example. So I'm not going, and as a prosthodontist, we won't come across a lot of those patients. So I'm not trying to learn the latest, greatest in management of pediatrics. And if and when we come across, we would make the appropriate referral. So that's my thing. But so every clinician have to think, what is their desire and goal to be competent in, and then maybe 3 5 5 years later they'll switch and say, I also want to expand into that other aspect that I'm not that comfortable with, perio and endo and ortho and and whatever, oral surgery, and they want to take on tougher cases and stuff like that. So we have to kind of mortgage and budget this scenario. So one thing that reminded me of my accountant when he was doing my numbers when I was a new grad, first 3 or 5 years, he had about 300 dental practices within his accounting practice. He said, Mark, because some numbers jump out, and I want to highlight that you spent on the high end on continuing education. He's saying, in terms of the budget and this and that, he goes, I'm sure you exceeded the requirements. So why are you on the outlier in terms of spending on your expenses, time, money on the tuition and away from the office. So I explained to him that I had wanted to learn more. And then he was saying, okay, just be cautious of those numbers because you're spending a lot more than your colleagues, the other 299 clients in my practice. But having said that, under the same breath, he goes, I'm also intrigued as to why you produce what you produce in that amount of time that you're at the practice. Again, your hourly production far exceeds. So he asked if there's a correlation to that. I said, absolutely. When you know
Yeah.
more, you see more, you do more. So in the same 40 hours per week, I'm able to, seize the opportunity and provide quality treatment and not be, guilty of supervised neglect. So it is an investment at the end of the day, and that's the way we have to see it.
Yeah, I'm glad you shared that story because, oftentimes the fees for these courses are extremely high and, new grads have a lot of debt, but like you said that, the more experience you get, you're actually going to bill more. So, the more knowledge you get, you're going to bill more. And so, the course has definite return on investment. And
Yeah,
my advice,
absolutely. Absolutely.
yeah, my advice to new grads, just to follow up with what you said, is I like how you said, do courses that you're interested in because you're naturally going to start gravitating towards different things. Like you gravitate towards prostho, I gravitated towards pediatrics. And as a new grad, I told the principal dentist I want to see a lot of kids because I like that patient group. So then I started taking a lot of courses in pediatrics so I can get better in that. And I would recommend taking courses like in the basics to get patients out of pain. So extractions, root canals, and also do courses in what you're going to be doing most, which is restorations, especially class 2 restorations. Take courses like in restorations, extractions, root canals. They're not sexy, but you're going to be doing a lot of that during your first few years and you're going to gain your confidence. And that's going to build the foundation for those other things you want to do later on, like veneers and implants, because you have those basic surgical and restorative skills.
Yeah, absolutely. Like, at the end of the day, patients come to the dentist for one of two reasons. One is to get out of pain, right? They wouldn't be there if they didn't have a bad experience or they're in pain. So you're right. To your point is you got to be good at the diagnosis and getting them comfortable, if you will. And then, of course, the other treatment that are more elective is for quality of life, whether it be cosmetics, whether it be function. Implants is still considered elective. They can consider partial dentures and restorative crown and bridge and stuff. So they only come to us for one of two reasons: to get away from pain or to improve quality of life. And we got to be, sensitive to that and be able to provide both ends of the treatment. Absolutely correct.
And then, Mark, what do you think of those, you know, very comprehensive courses that, they take maybe 8 weeks? You have to travel, for example, COIS. What do you think of courses like that?
So I've taken course. I've taken Frank Spears. When Carl Misch was around, he had his continuums also with surgery, prosthetics, and things like that. And I think those are all top-notch clinicians and courses. Then again, being a little bit cynical or critical, unfortunately, a lot of those courses, the theory and didactic is again top-notch, but there's not a lot of hands-on, and it's not a lot of practical implementation. So the task is for us to digest that material, and really the challenge to implement it within your practice. So you got to find the right patients who's willing or thinking about that type of treatment, and then you got to apply that theory. So John Coyce and myself had these conversations together. When we educate, we want to make sure that the investment or the education gets to good use, and implementation is the challenging part. And we both agree that if anyone takes any of our courses, if 20%, 25, 30% our participants are able to implement what we're teaching, those are phenomenal results, which again, 20, 30% is not that high. So I think if I if and when people are taking courses, especially new grads, I think they should always think about first and foremost the credibility of their speaker. Do they speak with science and try to give you evidence-based information? And that would be very, very critical. And in lack of evidence being available, then they have to share with their clinical practice, meaning they have to be ahead of your learning curve by a number of years. And then, of course, if there's a component where there's hands-on, whether it be model-based, whether it be on pig jaws, whether it be on cadavers, human cadavers, or the best ultimate one is really on live patients, because you can tie everything together. So I think there's lots of opportunities to get theory. The question is, can you and I, as a course participant, really take that theory and apply into clinical practice the next day? And that would be the objective of any CE. And I've
Mm,
certainly am guilty, and I've known some friends, they're CE junkies. They take lots
yeah,
and lots of courses. Then when you ask them, okay, did you implement anything new in the last 5 years in your practice? They say, no, I just keep doing what I'm doing. And I go, what was the point of that?
just entertainment.
Just entertainment. They want to travel, they want to meet with colleagues, they want to think. I go, but don't you want to learn something that you can bring to the table and help your patients? They say they do, but they resort to old habits.
Yeah, that's the pro tip right there. Is if you're going to take a course, you need to implement it right away. Because if you don't, you're going to forget it and you're not going to have the confidence. So you have to be strategic. Like you talked about being strategic in career in the last episode that you're on. We have to be strategic in our courses because they're very expensive courses. They're taking away they're taking away from your office, your family, your time. You have to consider all that. So instead of just saying, "Oh, let me look at, implants. Sounds interesting." Well, first think, are you referring out implants? Do you have the patient group who is asking for it, who needs it? And if not, you're going to waste your time during that implant course because you're not going to be able to implement it.
Yeah,
So yeah,
yeah.
pro tip, you have to be able to implement it.
Yeah, I think that's the thing, right? When we take courses, I've certainly have done some courses that in retrospect, I thought I wasted some time, energy, and money, because there
Mm,
wasn't a lot of meat to it. And so again, when we're looking at courses, I think we need to really have an objective and goal, which is, when I'm done, did I learn anything new? And am I going to bring something to our patient base to, improve the way or change slightly the way I practice? So out 30 some odd years, I get very excited when I learn something, techniques or technology, and I'm able to help our patients do something faster, better, less pain, and what have you. I get excited and I see, wow, that really worked, and the patient's really positive with the response and treatment. So after 32 years, that's kind of something that I look forward to. So when I walk the corporate floors or conferences, I'm looking at corporate tables. I'm looking at what instruments I can do something better and faster. I'm looking for implementations that can, facilitate patients' healing response and what have you. And again, just make things more predictable and better and faster for our patients, and in some ways, more cost effective for our patients. So those are all kind of top things that I'm looking for corporates and or on continuing education.
That's good. You pointed out you're very strategic. So if you go to a course and you're not writing down what you want to get out of that course, you're just going to get a free meal with that course. Not even a free meal, very expensive meal. So if your intention was, well, I'm going to go to this conference so I could just bump into my old classmates, then that's all you're going to get out of that conference.
Yeah,
But
yeah.
if you go to a conference and you're like, I'm going to go to these booths because I want to learn about these materials and techniques, and I'm going to go to this course because I want to learn this, that's what you're going to get out of it.
Right, right. Yeah.
Otherwise, you're just wasting hours on the exhibit floors just getting freebies and not learning anything.
Yeah, yeah. And sometimes okay to, have social events, this and that. And as
Mhm.
long as that's your plan, that's fine.
Yeah.
But certainly, there should be a very strategic strategy and agenda on, again, how many hours per year or per half a year, how much in terms of tuition costs that you're willing to budget, and have that strategy to do that. And I've certainly have done things where I go, okay, let's take a course, but I'm really not there to for the course. I did that as a GP. There was a course in Hawaii on ortho,
Mhm.
and I wasn't really that interested in ortho. I was just saying, okay, you know what, it's there, it's a good write-off. And I'm telling you, not myself and a whole bunch of us were sitting in the hotel room looking at palm trees waving out there, and we're all like, as soon as morning break came, like 25% of the room vacated that room because we were there for Hawaii. We were not there for the
Yes.
poor speaker. And I don't know after lunch if anybody's even left there. But well, again, in retrospect, I don't want to do things like that anymore. I said,
Yeah.
if I'm there to learn, I'm there to learn. I'm there to
Yeah.
vacation. I'm there to vacation. I'm there to,
Exactly.
just not think about dentistry or patients. I want to be
Yes.
family quality time and be in the
Mhm.
moment. But if I'm there for a course, I'm there for a course. So nothing should
Yeah.
distract me, and be very focused on why you're there, right?
Yeah, it's true. Now, what's your take on online courses? Live, online, and on demand?
I think certainly during the COVID time, we leaned heavily on that, which was it has its place. Certainly have some advantages. Obviously, online, if it's on demand, you can watch it in your own pace and your own time. You certainly save a lot of money traveling and being out of the office. Now, the only problem is we need some people that are very dedicated and disciplined to say, okay, family, friends, spouses, dogs, cats, leave me alone for the next hour and a half. I'm here to focus on this. And again, it's very, very difficult to do that, right? I get distracted. Someone calls me, texts me, all of a sudden I'm not paying attention. So certainly have advantages, but again, it's up to us to be disciplined to say this is block time, and maybe you don't have to watch a 3 hour webinar. Maybe, okay, you know what?
Yes.
I'm going to digest this in an hour. I'll come back for the next hour. I'll come back in the next hour. But at least when I'm here, I'm going to be undivided attention so I can get
Yes.
what I need to get out of this.
You're so right about that because so many times when I'm watching webinars, I'm cooking dinner or I'm walking my dog, and at the end, I'll say it like, "Oh, I don't remember. I didn't get anything out of that." But when I sit with like my notebook and I'm taking notes, like, wow, like I'm implementing it the next day.
Yeah, yeah. So again, that's discipline, right? Self-discipline that we have to be committed. I'll tell you a funny story. I play tennis with a three MDs. One's an internal medicine, one is a general practitioner, and one is a urologist. So one time we're playing, and then goes, "Wait, I gotta set up my phone." I said, "Are you
Yeah.
recording our match?" He goes, "No." He goes, I have to be on a study group doing lit review." So I go, "What are you doing?" He goes, "I'm turning it on like I'm watching it and listening it, but we're playing tennis." I go, "Are you sure you should do that?" I go, "What are you gonna miss?" He goes, "Don't worry, it's boring." So we start playing tennis, and then once in a while he would run up there, he would turn his phone on, like pretend he was part of it. He goes, "Oh, I agree with that totally." And then he goes, "Yeah, I think surgery is way to go." I go, no names mentioned. I go, "Victor, did you just recommend surgery on somebody when you weren't even listening on the case that they're talking about?" Go, "Yeah, yeah, don't worry. These guys are we're all do it like that." I go, "Damn." I go, "I hope I'm not the ones gonna get operated on because you just jumped in and listened to the last part." So like, I mean, and I've certainly seen other people that, they turn on the webinar because
Yes.
they get tested or the time gets recorded or
Mhm.
something. But at the end of the day, I always think back, if my father, my mother, myself ends up being somebody's chair or being under
Yeah.
somebody's knife, what would I want him or her to have done during this webinar or
Yeah.
CD? I want them like you,
That's golden.
undivided, have a notebook and pay attention. So, why would we do anything different for our patients? So,
I love that. Yeah, that's a really good way to think about it. And speaking of like online webinars, I use it as a great way to see whether I should see that, spend more money and see that speaker at a conference, or to see their like, or to, sign up for the comprehensive course. Like, for example, you mentioned Frank Spear and, and John Coyce. They have a lot of free webinars and YouTube videos online. So check them out. See if you like their learning style, content. And then if you do, then sign up for their
oh yeah.
compendiums.
Yeah. And I think back to the webinars and stuff, I think, if you have it recorded on an iPad on your laptop, if you're like on a plane and on a train, and now
Yeah.
like, like I'm pretty sure I watch every movie that's on whatever the display. So it's nothing to watch, nothing different. So I think that's a very good way to, I'm on the plane for 3 hours. I'm not gonna be
Yeah.
watching the whole thing for 3 hours, but at least the first hour and a half, digest some of the material, get undivided attention. So there's times and places for that that I think would be, helpful, and it'll make you think about and stay focused. But on a daily basis, it's tough unless again you block schedule in your time to say,
Yeah.
everybody
Right.
and every animal, leave me alone for the next hour.
And staying focused is critical because when I first graduated, we didn't have cell phones. So I would go to courses and take notes. And then once I got my phone, I stopped taking notes. I would just sit there and take screenshots every once in a while. And I found that I wasn't getting too much out of it. And then recently I started taking notes again.
Yeah.
And I find that I remember the material much more, that I'm more likely to refer back to my notes. And I still take screenshots, but I will do screenshots and notes.
So now they have apps now. I'm not sure if you are aware, they
Yeah.
have apps that can help you record the lectures and stuff, so you don't have to take your own notes and stuff. But we have adults learning that simply says, if we're gonna learn something as adults, we have to hear something 7 to 8 times repeatedly
Yeah.
before we can even learn to digest the material. Not that you would remember it. If you write it down, that will shorten that learning curve. So again, I've seen other speakers, and when I give notes, I say every slide is in your handout. You don't need to rush trying to copy things on the screen, which is the
Yes.
good old days we used to do that.
Yes.
And on strategic slides that I want to remember, I would, on my slides, I would have the answers or the objectives, but the handout, I'll leave three blanks. Like, for example, what are the goals of implant surgery? And I would have four blanks, I would say, and then I would review each topic, put it implant in a prosthetic restorable position to get primary stability, to avoid any iatrogenic damage, yada, yada. So when you do it like that, very strategic on the important slides, I think there's a deeper learning curve that, to your point, is they will write it and be meaningful, and then when they review it, it's in their own handwriting, they will recall better. And so this is all with adult learning kind of, I guess, studies and they've done.
Yeah. Another technique I use is, say I'm at a conference like the annual spring meeting in Toronto. Then, my friends are taking some courses, I'm taking different courses. So then I'll say, afterwards I'll say, okay, what did you learn? And then I'll tell them what I learned, and they have to share with me what they learned. And if you have to teach someone else, then you remember it more. And if you know that you have to teach someone else because they're waiting to find out, the pearls that you learned during that course, then you make sure that you're writing things down, you remember it, you're repeating it back in a way that you can teach someone else. So teaching someone else is a really good way of remembering what you learned.
Yeah, absolutely. It's the old saying, right? See one, do one, teach one. And just
Yeah.
like the residency programs, we rely on the seniors to help the juniors, third year to help the second to help the first year. And even today, when I'm lecturing, the most innocent, benign questions get asked by newbies, makes me reflect and think about, I've been blurbing out certain concepts, but when they ask it in a different angle or a different deeper meaning, I go, oh, you know what, that's actually a pretty good question. And so, and all of us who teach will tell you the best way to learn is to teach. And when you
Yes.
teach, it forces you to do your homework, making sure the science is behind what you say, and to confirm that again, all the variables and different clinical situations that you've covered, and then whatever comes out of your mouth, I'm thinking is pretty serious information, because somebody to take me literally, and I better give good information. So, the challenge is on all educators to do their own homework, and 110% you for sure learn more when you teach. And yeah, that's a great collaboration. If you have dedicated, colleagues say, I can't go to this course, I want to hear what they have to say. So let's divide it as a team. You go to that one, you go to that one, and then we come back, more like a study club. Let's grab dinner together, informal, and let's share. I'll tell you what I learned from my course. You turn, and again, that kind of, it's a segue to talking about study clubs that are available for that, purpose.
Yeah. So yeah, study clubs are great because it's not just a lecture. There's smaller groups, you get to interact, you feel more comfortable asking questions because you're with the same small group all the time. It's more interactive. So that's how we structure the new dentist study club. What's your experience with study clubs?
Oh, it's phenomenal. And I think, even though I run my own my Tide Institute, one thing I think lacks for a lot of these places, including Coyce and Mish and Spears, myself, and stuff like that, is that although we have that information, the ongoing support and mentorship is very, very critical. So if you're done a handful of implants in any courses, well, your real learning curve comes from the next 100 implants. And and I think a study club is more of a friendly environment. Like you said, you already know who they are. Everyone speaks openly. We don't have to hide. We don't have any egos. Oh no, I never get failures and stuff like that. So we're open. I go, this happened. The wound opened up early and I didn't know what happened. Can you share with me what's going on? And honestly, if you get yourself in a circle of like-minded individuals and you have this collaboration, that is the best way to learn, because they will say, this has happened to me, that didn't happen to me, I went and did a course and they taught me this. And a lot of times I learn more from just sitting, casually with somebody having dinner, as obviously a dentist, and I go, whoa, that I never thought of that.
Yeah.
And you actually learn something valuable there too.
Excellent. I'm glad you brought that up because the best education is actually an education you can get for free. You
Yeah.
don't have to sign up for something structured. That dinner before the lecture starts, that could be where you get the most learning because you're in this intimate environment eating dinner with your colleagues and you're very free to talk about your struggles. And also shadowing, like talk to the specialist you refer to and ask if you can shadow them. You learn a lot that way. Even going to the exhibit floor at conferences and going up to the vendors, I've learned so much because I tell them about my struggles, and then they're like, "Well, you can use this. You can use this technique." And I've just changed like all my materials and equipment in the last 5 years, and I'm so much happier because I talk to vendors.
Yeah, so you raised two very, very good points. When I was going through dental school and finishing my residency in the hospital, out of dental school, I had intended to go into oral surgery. So I went and shadowed some oral surgeons. They were very, very welcoming. They were very, informative. So I want to know what an oral surgery office does. And this is back in 1993, 94. So probably way before any most audience time. So, I think shadowing different offices will give you a perspective on the administrative and clinical aspects. What does that office, how does it run? And is this something that I can envision myself doing? And if you end up getting a specialist that will let you shadow clinically over the shadow, that's invaluable in terms of, like, I don't know how much you can pay or not pay. And the strange thing is most of these individuals will not ask for money and just say, okay, come along and just shadow and watch what we're doing and this and that, and you will be learning a lot. The only thing is we'd be very mindful there are patients sitting there, so maybe take the questions when it's outside the operatory. Don't be asking in the middle of the procedure because
Exactly.
the patient hears
Yes.
everything and stuff. So if you are mindful of that, it's a phenomenal learning scenario. To your second point about the corporate floors, I've noticed a lot of dentists walking the corporate floor. They don't want to make eye contacts with the reps because they think they're gonna get hassled or harassed at buying a ton of stuff.
Yes.
I'm like you, I'm very opposite. I go up to them, I engage them, and I just say, what's new and this and that. Because again, how else can we get that information? The whole point of going to corporate floor. So when I go to these conferences, I dedicate half a day. Okay, you know what? I'm not gonna go to courses, this and that. I look at the schedule. I say, okay, this half a day looks like the speakers and this and that. As I'm gonna dedicate my other time to the hands-on courses or other speakers. But this half a day, I'm doing the floor, and I'm again very strategic. I'm gonna go to the booth that I think is gonna benefit and help me. I'm not gonna stop by a uniform place for too long because I'm not gonna buy uniforms there. I'm not gonna look at toys and for kids and
Yeah.
stuff. So I'm very strategic in saying, you know what, I need to see where are we in digital technologies for virtual articulators, or I'm gonna see is there anything to enhance occlusal analysis and yada yada. So again, I'm very strategic, and when we are, then I will stand there and say, please teach me and tell me what you're offering. And again, if we can bring one or two or three things back to the office and implement it, it's a win.
Yeah, and oftentimes if you take the time at their booth and show interest, they'll give you free samples and you can try it out. And then oftentimes I end up implementing it because it is the latest and greatest product. And if I walked by just to get like free gum and kept walking, I wouldn't learn any of that.
Yeah, yeah. Freebies are always good, and it's their way to attract you to the booth. Fair enough. That's just these conferences how it works and stuff like that. Like, I mean, I'm thinking back in 1993, 94 when I passed my boards. We were doing amalgams, we are doing gold foils, we are doing gold inlays. We had to cast and invest our own. Very soon after that, we stopped doing amalgams back in 1993, 94. I haven't done one. I wouldn't even know how to do one right now. I don't have a triturator with in the office. So I think, a lot of the material that's taught in dental school may or may not apply to us when we're in real life practice. And again, as time goes on with all the advances, technologies, and digital formats, things are going to just keep changing. And if we don't stay with the times, then I think we will fall behind. And, you know, I think it's a disservice to our patients. And that's why a lot of the CE in different provincials and states pretty much is mandatory because they want us to make that events, stay up with the times, if you will.
Yeah. Well, thank you, Mark. The last question is, tell us about the best course or courses that you've taken.
Good question. I think the best courses has to be related to where you are in your education, and sometimes it's clinically case driven. So, for example, after 32 years, um, I'm very intrigued in learning how to do our best vertical bone grafting. So vertical bone grafting, every surgeon will tell you it's challenging at best, and the results may or may not be predictable. So, when I wanted to be more competent and more confident in vertical bone grafting, I looked for certain courses, and Dr. Urban from Budapest, he was offering courses. So when I went to there, I was very hungry to learn, like every little tidbit of advice, clinical, protocols. I was like very eager and willing to learn everything, because again, I searched them out. He has credentials, very well researched, very well published, world renowned. So I invested time, energy to go to do that. So I think the best courses are the courses where there's again a thought process where I think I'm either having problems with some clinical outcomes, or I plan to do more of these cases with confidence and predictability. And with that in mind, you do your homework and you search out who is the best person to teach that. Now, again, it's caveat on mine is that this is an investment in your knowledge that you're going to put to use until the day you retire. And it's sometimes it's a little bit concerning when people are finding cheaper courses or free courses or corporately driven courses and stuff like that. And so they fulfill their CE credits, then whatever, 90 hours in 3 years. But it's concerning because I'm not too sure what is the quality of what's being taught. And again, I think that there should be a clear process that it's not the tuition cost that's costing the most. It's your time away from practice or time away from your family. That is valuable. So if I'm taking time away from clinical practice or my leisure time or social time, I better get something out of the course. And the tuition is neither here nor there. When everything, the dust settles, if you can put it to clinical practice, it's worth its weight in gold. So it's should not be the deciding factor. And I think that's in some people that are a bit of a mindset that you got to think properly why you're going to these CE courses to begin with.
That's great, Mark. I like how you talked about, you specifically want to learn about vertical bone grafting. You chose the best course and you did it and you implemented it.
Yeah, for
So for
sure.
me, yeah, so for me, I would say for my best course, it was on silver diamine fluoride. It was just a webinar. But the reason why I would say it's the best is because we did it with the whole team. And, before, the dentist would take some courses, the assistants would take some courses. And because we all took the same course at the same time, immediately we all started implementing it because we all knew why, what the indications are, how to use it, how beneficial it was. So that's why we got full buy-in. When I take a course on the weekend and I come in on Monday and I just start doing things differently, the assistant doesn't understand why. And then we don't have a good workflow because she doesn't know like when to have it ready and when not to. So you really have to, whatever you learn in courses, you have to share it with your team.
Yeah,
So
absolutely.
yeah. And
I
then they
think
will
that
know, they will recommend when they see you struggling, they'll be like, oh, do you want that instrument? Because they will know why you need that and when.
Yeah, absolutely. If you really want to implement something like, say, ortho, Invisalign, or implant dentistry or something, really getting the team to be there. And I'll speak to this. I know how team members work. You know, team members, I've been around 32 years with 25 staff. So, team members will see, okay, Dr. Lin went to 2, 3 days, some kind of course. He comes back, he's all pumped. He's saying, we're gonna do this, we're gonna do that. And the staff will say, okay, you know what? Let's go along with this. and just give it 2 weeks. In 2 weeks, the momentum will die down. We don't talk about it. We don't get it for him. And we're all, you know, back to our good old nature habits. And then go, see, I told you nothing will happen. So, you know, but there's other staff that will, you know, be on board and they say, you know what, we're
Yeah.
going to do this as a team. And that's what we want to create, that kind of culture that they get involved. So absolutely in a team approach and courses that and get the teams involved is very, very beneficial. That's the best way to get implementation. But now you can invest
Yeah.
time, energy, money to get them to the courses.
Yeah, it's true. Well, thank you, Mark. I
But
think
one
we
one
just
final thing, one final thing I do want to speak to the new dentist is this.
yes.
It's education, but the most formal ever. I think if you're out within 5 years, which is your memberships, any of the dentists who are out within the 3 to 5 years, they should think about specializing. And now I'm of course biased, but I think you know, if there are any of the members are gravitating or at least leaning and thinking about it, they should think about it within that 3 to 5 years. First 2, 3 years is great. You get your finger wet, you get to do different types of dentistry, and you naturally know what is, you know, a calling for you, if you will, right? And but if they feel like that's a possibility, I would suggest they don't wait too long and really pursue that. And you know, if they are thinking about specialty or one form of specialty, they should do it within the first 5 years, or at least start the application process, because you might not get in the year you want to get in. So it might be a few years before it gets going. So again, I'm speaking because pretty much divided 13 years as GP, 15 years as specialist, that you know, if they're interested in that, they should lean into that. And that is like the most formal education. Now you become quote unquote expert and specialist in that field.
I totally agree with you, Mark, because I have some friends who are really interested in a specialty, but they're like, no, no, now I'm too old. And I have a couple of my friends who went into prosto when they were 40, married with two kids and 2 or 3 kids, and that was so tough for them to juggle their family and specialty training. Yeah, and look, I wish I specialized, in those first few years. And so I wish I had your advice. So the whole purpose of this podcast is to accelerate the careers of our listeners so that they don't make the same mistakes we did. They learn from those mistakes and they have happier career. And I'd like to thank you, Mark, for being on our podcast a second time. Lots of words of wisdom. And I think we just proved to our audience that another great way to learn is through podcast.
Yes,
Like
absolutely.
free education right here. Like Mark is a prosthodontist. His time is so valuable, but he just took this time twice to share all of his wisdom with us on career strategy last month and this time on continuing education. So, Mark, how can the audience reach you?
Well, I only have two sources of contact. One is my cell number. It's one and only. I'm sure you can share that to your members. So
Yeah.
if they have any questions about potentially specializing in any specialty, or they want more information about certain courses, I can direct them. It could be mine, it could be others, because we don't offer everything for everybody. And I have an email address that you have. I'm sure you can share with them.
Mhm.
And I'd
Yeah.
be happy. So all I ask is maybe they'll say, okay, I'm part of the new dentist study club, and I watch the podcast. Can I have this question? Because that's why I have a frame of reference where and how I met certain people. Otherwise, it's kind of, if they just come and ask me a certain question, I go, okay, where did this come from and
Yeah.
what was this all about? So if they just give me a little frame of reference where they're coming from or where they got a hold of my contact, and usually I'm pretty good that I would reply to them within a couple of weeks. Probably again, my cell number and a text is fastest, easiest.
Okay.
Now, so I usually check, you know, once, twice per day and whatever. Usually I'll reply within a couple of weeks. Usually it's normal.
Yeah. Don't text Mark while he's watching a webinar because he has undivided attention on that
Yes,
screen.
yes, yes.
So I'll put your contact information in the show descriptions and on Instagram. And please check out Mark's club. in Toronto, the Toronto Institute for Dental Excellence, or TIDE. It provides fantastic hands-on programs.
Thank you.
So,
Thank you. Looking
yeah,
forward to meeting everybody sooner or later,
yes.
one way or the other.
Thank you very much, Mark. And thank you to our audience for listening. Until next time, stay tuned.
Thanks. Bye, everybody.
Thank you for listening to the New Dentist Study Club podcast. Follow us on Spotify, Apple Podcasts, and YouTube, as well as our Instagram page at New Dentist Study Club. Check out our link in bio, and you can register to be a member and attend one of our live in-person events in Toronto. Thank you so much for listening. Please share this episode with your friends and stay tuned for our next episode.